Hello, so we'll talk about the disadvantage of shortcut treatment or incomplete dose of, especially antibiotics in treatment of bacterial infections. Like most of you who rush to chemists once they feel anything to go and buy one bicham, one tablet of this level, doxycycline, to give you underdose. It has a very high disadvantage risk. One, the bacterial adaptation. You will not recover. That's slow recovery, and another way you can call that bacterial adaptation, antibiotic resistance. Sometimes the bacteria that are more vulnerable will die, then the ones that are more stronger will survive, thereby building what you call superbug. The superbug now, in the sense that they will produce new ones who have the same threat as them, the one that can resist what they resisted while growing up. Just like when you survive as a man on the house, your children, you will not train them up in a way that they will survive any condition, they will be strong. So that's what that one will do. And thereby giving you short treatment options, or you won't have more treatment options. Like when you do a culture test, you will have less antibiotics to use for your case. You may have only one sensitive, which might not be available or which might not really work out for you. So, but when you don't abuse those drugs, whenever you are called for treatment or you are due for any treatment, you take any antibiotics that is sensitive to the bacteria, it work. But when you have abused them over the time, your body or the bacteria have been resistant to that drug. So you taking them, you're just wasting your money and your time. You're just taking chalk. Nothing's gonna work anymore. So what you do is this. And from now, before you take antibiotics for some cases, you do proper sensitivity tests. The only condition where you can take antibiotics randomly is for prophylaxis, and it should be prescribed by a well experienced, qualified medical personnel or pharmacist. So he or she will be able to ascertain the one that can be able to curtail that problem. Not a case where you have a superficial infection, soft tissue infection. Actually, you'll be treating the one that you use for Samolina, or be use the one for gram positive to gram negative. Nothing is gonna work out. So you use, when you have a gram positive bacteria, an experienced pharmacist or medical professional will also use a gram positive antibiotics to treat you, because using a gram positive to treat a gram negative doesn't yield any result at all. So before you take antibiotics next time, make sure it's prescribed by your pharmacist or doctor or a physician or whatever you call him, experienced one, to avoid the money waste, prolonged illness. Thank you. God bless you.